Today is the launch of the Persistent Physical Symptoms Service, which is a service that basically crosses all the trusts, and we are looking at developing a service for people with persistent physical symptoms, and that includes chronic pain, chronic fatigue, what's called medically unexplained symptoms, and some functional neurological problems. And today is a launch event to explain that to referring GPs, physiotherapists and other allied health professionals.
We want to give them a great idea of who we are, what we're doing, what we can offer, which patients this service is aimed for, and how they can refer their patients into our service.
It's a multidisciplinary approach, so basically patients will be able to access clinics and there'll be teams who'll be able to treat multidisciplinary symptoms with all in the same room basically. So instead of the patient having to see multiple different medical professions, they'll be able to access that all in one room at the same time.
I was asked to talk about prescribing and prescribing habits in chronic pain for chronic pain patients, and this new project might be very useful in, for instance, getting people off opioids, because we are seeing way too many patients these days on opioids and on high doses.
I've been working with the physios across Cumbria for a number of years. I used to be a physiotherapy lead, and I acknowledge that some patients are really complex and they actually need an integrated pathway, working with psychologists, CBT therapists and physiotherapists. So my role has been working with the physiotherapists to work out who is the most appropriate people and patients to go through the pathway.
Part of that service is incorporating digital assets of PainSense, which is the Pain Toolkit app, which helps patients to self-manage their own persistent physical symptom of pain and gives them tools and support to help themselves.